What is amniocentesis? When is it recommended? How is it performed on pregnant women? Today, we're diving into a very important medical topic that many expecting parents may hear about during pregnancy: amniocentesis. Pregnancy is a journey filled with wonder and anticipation. As expectant parents, you eagerly await the arrival of your little one, filled with hopes and dreams for their future. Amidst this excitement, prenatal care plays a crucial role in ensuring a healthy pregnancy and providing valuable insights into your baby's development. One such prenatal test that offers a window into your baby's genetic makeup is amniocentesis. Amniocentesis is a medical procedure that allows doctors to examine the amniotic fluid surrounding your baby in the womb. This fluid, a rich source of information, contains cells shed by your baby, providing valuable clues about their genetic health. By analyzing these cells, healthcare providers can detect potential chromosomal abnormalities or genetic conditions, empowering you with knowledge to make informed decisions about your pregnancy. This essay will delve into the intricacies of amniocentesis, guiding you through the procedure, its benefits, risks, and the importance of open communication with your healthcare provider. We will explore the reasons why amniocentesis might be recommended, address potential concerns, and empower you to make informed choices that align with your individual needs and values. Ultimately, the decision to undergo amniocentesis is deeply personal. By understanding this procedure and engaging in thoughtful conversations with your healthcare team, you can embark on your pregnancy journey with confidence and peace of mind. Inside the procedure, a step-by-step guide to amniocentesis. Amniocentesis, while shrouded in medical terminology, is a relatively straightforward procedure. Understanding each step can help alleviate anxiety and empower you to approach the test with a sense of preparedness. Let's break down the process. First, preparation is key. Before the procedure begins, your healthcare provider will use ultrasound to determine the safest and most accessible location for amniotic fluid extraction. This imaging technique helps visualize the baby's position, the placenta, and the optimal site for needle insertion, ensuring accuracy and minimizing risks. Next, a gentle approach is taken. Once the ideal location is identified, your abdomen will be cleansed with an antiseptic solution, and a local anesthetic will be applied to numb the area. This helps minimize discomfort during the procedure. Using continuous ultrasound guidance, a thin, hollow needle will be gently inserted through your abdominal wall, uterus, and into the amniotic sac surrounding your baby, then collecting the precious fluid. With the needle in place, a small amount of amniotic fluid, typically about a tablespoon, will be withdrawn into a syringe. This fluid, containing your baby's cells, holds the key to unlocking valuable genetic information. Finally, post-procedure care is essential. After the amniotic fluid is collected, the needle is carefully removed, and a bandage is applied to the injection site. You may be advised to rest for a short period after the procedure and avoid strenuous activities for a day or two. Unlocking genetic secrets. What does amniocentesis reveal? Amniocentesis serves as a powerful tool to assess your baby's genetic health, providing insights into their chromosomal makeup and identifying potential genetic conditions. The amniotic fluid, rich in fetal cells, holds the answers to these crucial questions. One of the primary reasons for amniocentesis is to detect chromosomal abnormalities. Chromosomes, thread-like structures within cells, carry our genetic information. Any deviation in their number or structure can lead to conditions like Down syndrome, also known as trisomy 21, Edwards syndrome, or trisomy 18, and Patau syndrome, or trisomy 13. Beyond chromosomal abnormalities, amniocentesis can also identify specific genetic disorders. If you or your partner have a family history of a genetic condition, such as cystic fibrosis, sickle cell anemia, or Tay-Sachs disease, amniocentesis can determine if your baby has inherited the gene mutation. Furthermore, amniocentesis can be used to assess fetal lung maturity later in pregnancy, particularly if there is a concern about preterm labor. By analyzing specific substances in the amniotic fluid, doctors can determine if the baby's lungs are sufficiently developed for delivery. This wealth of information empowers expectant parents and healthcare providers to make informed decisions about managing the pregnancy, preparing for potential challenges, or considering available options. When is amniocentesis recommended? Navigating the decision can be, a bit complex. While amniocentesis offers valuable insights into a baby's genetic health, it is not routinely performed on all pregnant women. The decision to undergo this procedure is typically guided by specific factors and is often recommended in situations where the potential benefits outweigh the risks. First, let's talk about maternal age. As women age, the risk of having a baby with chromosomal abnormalities, such as Down syndrome, increases. Amniocentesis is often offered to women aged 35 or older who are pregnant to assess this risk. Next, we have abnormal prenatal screening tests. Routine prenatal screening tests, such as blood tests and ultrasounds, provide initial assessments of a baby's risk for certain conditions. If these screening tests raise concerns or show abnormal results, amniocentesis may be recommended for further investigation and confirmation. Then, there's the family history of genetic conditions. If you or your partner have a family history of a genetic disorder, amniocentesis can determine if your baby has inherited the gene mutation. This information can help you prepare for potential health challenges or explore available treatment options. Also, if you've had a previous pregnancy with a genetic condition, amniocentesis may be recommended in subsequent pregnancies to assess the risk of recurrence. The decision to undergo amniocentesis is deeply personal and should be made in consultation with your healthcare provider. They will consider your individual circumstances, medical history, and the potential benefits and risks of the procedure to guide you towards the best course of action. Understanding the risks, weighing the benefits and potential concerns. While amniocentesis is generally considered a safe procedure, like any medical intervention, it carries potential risks that should be carefully considered. Understanding these risks in the context of the potential benefits allows for informed decision-making. One of the primary concerns associated with amniocentesis is the risk of miscarriage. The procedure, involving the insertion of a needle into the uterus, carries a small risk of pregnancy loss, estimated to be between 1 in 300 and 1 in 500. Another potential risk is amniotic fluid leakage. In some cases, a small amount of amniotic fluid may leak from the vagina after the procedure. This leakage usually resolves on its own and rarely causes complications. Infection, while uncommon, is another potential risk associated with amniocentesis. To minimize this risk, the procedure is performed under sterile conditions, and antibiotics may be prescribed as a preventative measure. Needle injury to the baby is extremely rare, as the procedure is performed under continuous ultrasound guidance. The ultrasound allows the healthcare provider to visualize the baby's position and guide the needle safely into the amniotic sac. It's important to remember that the vast majority of amniocentesis procedures are performed without complications. However, being aware of the potential risks allows for informed decision-making and open communication with your healthcare provider. If you found this video helpful, be sure to give it a thumbs up, share it with others who might be curious about this topic, and don't forget to subscribe to stay updated on more pregnancy and health-related videos. Thank you for watching, and take care. Like and subscribe for more informative videos.